Hello, my name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the Massachusetts General Hospital Frontotemporal Disorders Unit. And I'm proud to welcome you to the third part of our four-part webinar series, the Care Plan Trifecta, Person-Centered Care Planning for Every Stage of Life with FTD. Today, we're in Module 3, providing you guidance for the home community. And don't worry, I'm going to give a little refresher and get more into what that means. So the MGH FTD unit is a clinical research program focused on frontal temporal degeneration, atypical and young onset forms of Alzheimer's disease, and related dementias. We're committed to providing the highest quality of care while working tirelessly to search for a cure for these conditions. And we're so happy to invite you to this webinar series. We know that families are living busy lives and that you need educational resources that are accessible to you during times that work for your life. So you can watch this webinar series anytime you need, as many times as you need. We're going to be talking about person-centered care planning, reviewing those first steps after a diagnosis. We're going to talk about how the Care Plan Trifecta can work for your family. And then I'll be joined at the end of the webinar by our wonderful manager of Caregiver Support Services, Amy Almeida, for a question and answer session. So let's review. The Care Plan Trifecta is a framework. It's to help you develop a person-centered care plan that centers on the person living with a diagnosis, their care partner, and the community that they live in at the center. The Care Plan Trifecta can help you unify healthcare with personal values and goals of care. We have three pillars that are critical to this Care Plan Trifecta framework. The first pillar is the medical community. And you can see more about that, learn more about the in-depth experience of the medical community in Module 1. The second pillar is the home community. And because this is such a complex pillar of care planning, where we live, we know that all care doesn't happen in clinic, that we decided to do it in two parts. So this is the second module talking about the home community. And then the third pillar, which will be our fourth and final webinar in the series, is about the patient advocacy community. So when we talked about the first pillar, the medical community, just to give you a summary, what we really focused on is this is a critically important part of your care planning. And it might seem obvious because care planning feels like it's related to medical care, and it is. But what's unique about our model of care, the Care Plan Trifecta, is that it integrates medical care with your daily life in your community. So for the medical community, there are three things that I want you to remember that are critically important. The first is that connecting with expert providers who can give you an accurate diagnosis about the condition that's causing your behavioral, mood, or cognitive changes is critically important so that you know what are the right treatment or research options that can help me live the highest quality of life, even given these new challenges that I'm experiencing. And then lastly, and this is one of the most important, after you receive your diagnosis, after you find out what are the right treatment and research options for me, you want to connect. You want to connect to all of your healthcare providers so that everybody's on the same page and knows who to talk to about what is likely co-occurring conditions. I always say if somebody had high blood pressure or diabetes or back issues before they got a diagnosis of Alzheimer's or FTD, they're going to have those same issues after. And in fact, the care plan, the prescriptions that we write for care for those previous conditions may need to be altered, adjusted, or given more support with this new diagnosis of dementia. So the home community. This is so important because we want people to know that Just because a diagnosis has come into your life doesn't mean that living, that joy needs to go out. You'll hear me many times use the phrase person living with a diagnosis. And so when we think about the home community, this module is really talking about continuing the journey. In our last webinar, we talked about what are the first things that you should do related to the home community? What are those first early steps? And we're going to talk about the domains of legal and financial, local resources, and of course, love and support. Oops. Okay, so emphasis on the home community, part two. And, we think of this as a dementia journey. I was talking with my wonderful colleague, Amy, and we were saying we like this icon, this little person, because they're walking with a cane, they're getting a little bit of support, they have a backpack for supplies, and you're going to need all of those things for your journey: supplies, support, and definitely love and connections. So when we talked about what are the first things that you might want to do? What do you want to do right away after you receive a diagnosis? That's really talking about the early stage. Some people receive a diagnosis when they are already in the early stage of dementia, but other people receive a diagnosis while they're living with mild cognitive impairment or mild behavioral impairment. And so, really, there are a lot of things to do legally and financially. This may include making new legal and financial decisions. You need to make sure that you're connected with an expert, a certified elder law attorney, to make sure that all of your legal and financial documents and plans are in place. You may even need an attorney to help you transition from working in a professional environment to maybe working at reduced hours or even retiring. But these are all things that you want to discuss with an attorney. And then I listed life care management, adult day health programs, companion and home care. These were services that we talked about as being most relevant during the earliest stages of the dementia journey. Today, what I would like to talk with you about more is how can the home community, this central pillar of the care plan trifecta, support you and your family during the moderate and the late stages of life lived with dementia. We think about the moderate stage, probably there are going to be new services or new needs for services that are going to pop up. One of the first ones that I think about is transportation, because we know that when you're living with cognitive impairment, it's often important to make the choice not to drive anymore. And if you're not driving, it doesn't mean that you don't have anywhere to go. In fact, now that you're living with this new diagnosis, it can be more important than ever to stay socially connected, to find programs for support, to go places and learn that there is a community of people traveling a similar journey and they can give you support and care. So transportation is something that you're going to need to look into during the moderate stage. Task initiation. What about things like meal prep? Maybe the person living with a diagnosis during the moderate stage, they would do great at eating their meals when they're presented in front of them, but they might struggle to maybe cook raw chicken safely or struggle to know, gee, did I already eat breakfast today? And then those things can be critically important because some medications need to be taken with food. And also, we just want to make sure that everyone has the best nutrition that they can after a diagnosis. And it's not just the person living with the diagnosis, but their care partners as well. So, medication management, personal care, this is where you start to see some overlap with things like companion and home health aides, that maybe in the early days, they're providing a ride somewhere. They're providing the true companion, like, oh, we're going to go to this yoga class together. We're going to volunteer our time at the local senior center, when really it's those companion needs. But at the moderate stage, you might need help with incontinence, you might need help with dressing, you might need help with bathing. So these are just things to think about in that moderate stage. And it's so important, as I mentioned, to stay engaged and connected. This promotes cognitive resilience, health and wellness, and it can really solidify personhood. Think about someone who their faith has been incredibly important to them. Learning how to still find transportation to their faith services, maybe volunteering, but with a support person. Um, Being able to experience those rituals can be incredibly rich and deeply meaningful. We know that people all want to have purpose, and finding out resources and supports can help people still live with purpose, give back, and get that support and care as well. In the late stage in your community, we're talking about more medical oversight. In fact, additionally, support for medical decision making and advanced care planning, which we'll talk more about and in depth. Activities of daily living in the late stage may include personal care, nutrition, comfort, and more than ever in this stage, families can need emotional support, guidance for advanced care, and grief support. As you advance along the journey of living life with dementia, you can always revisit legal and financial plans that you've made. So just really think about maybe right after a diagnosis, you met with your attorney, you updated all of your estate documents, you updated your will, you have your new healthcare proxy, you have your power of attorney. And now it's been 5 years, and you could be in a different stage of dementia. You want to make sure that maybe the caregiver's health is in the same place. Are you living in the same location? It's always a good idea to review those documents and make sure that they match with your life circumstances, your values, and your goals of care. Decide on those decision makers. Make sure that the people who you decide to be decision makers are still healthy and available to be those decision makers. And then continuing to make financial plans for future care needs. Dr. Dickerson, who's the director of the MGH FTD unit, he says that one of the most common questions that he gets from families when they come in for appointments is, what is going to happen? They're asking him to prognosticate. What's the prognosis? And it can be very challenging. But something that he often says is that each person with a diagnosis is on their own unique trajectory. And so learning what your trajectory is over time can give you more information about potential future care needs and may cause you to adjust financial planning. So, this is just a real shout out that, legal and financial planning is not a one and done, but something that does need to be revisited. I thought about updating the slide, but when I reviewed it, I thought, no, these are all the most important things. When we're talking about communication and connection, these are three important questions to ask. What questions do we ask to know what type of service is right for our care situation? These are questions that you're likely going to ask of your medical provider. It might be the expert who identified your neurodegenerative condition, who diagnosed you with Alzheimer's or FTD. It might be your primary care physician who's known you for a really long time and understands your other medical conditions. But continuing to ask questions as life progresses with the diagnosis can give you more insight about what care you need and not to miss out on receiving care. How do you find the services that you need in your community? At every slide along the way, when I tell you about a service, I'm going to tell you how to find it. And that is critically important. When is the right time to connect with services? I say the right time is early because the thing is, most services have an evaluation process. And if you go in and you get evaluated and they say, oh no, you're a little bit too early, not yet, then you can come back. But man, what if you were evaluated for a service and you found out, oh boy, you could have been getting this a year ago? So I just always encourage families, as you learn about services, reach out and find out if you're eligible. Last time we talked about uh, different services that you would access in the home community, mostly related to the early stages, the early days of living life with dementia. We talked about life care managers and how they can help you do safety evaluations and write documents for your personal care, your goals of care. We talked about adult day health programs as a way to provide connection, cognitively appropriate curriculum, social engagement, and respite for care partners who may or may not still be working. We talked about home care as a way to bring people in and start to build your deep bench of support. Today, I'd like to go more in depth, looking at what are the services and supports that you're likely going to be engaging in the moderate and late stages of life lived with dementia. We're going to start by talking about assisted living and memory care assisted living. And we're going to really talk about what is the difference between memory care assisted living and skilled nursing care. You can see here that memory care assisted living and skilled nursing care both provide 24/7 residential care, but there are nuances about the type of care, the type of staffing, the type of engagement that we will highlight. But what's important to know about both environments is that they offer structured environment for engagement, nutrition, and social connections, which is critically important at every stage. We're also going to talk about hospice and palliative care. Something I think that has been a surprise along the journey working with families is that hospice can be engaged at earlier stages than people necessarily anticipate, and it can be so supportive. It can promote families' goals of care in other ways. So these are going to be the areas that we're going to focus on during this second module of the home community. Okay, let's start by talking about assisted living and memory care assisted living. There may come a time where you realize if you're caring for someone living with a diagnosis, you might realize, boy, the living environment that we're in just isn't providing enough structure and support, and we need more. So this can happen when you're living with a person with a diagnosis of dementia. It can also happen when a person living with a diagnosis of dementia lives on their own. And so many people have heard of assisted living. These are independent living environments. You'll often see them. They look like lovely communities where you drive in and maybe there's a nice gondola or, ample parking. And you walk inside and it looks kind of like a welcoming, beautiful hotel. And these communities often have different apartments, different living options with different levels of support. So, assisted living is typically when you rent or lease an apartment in a community, and it's your own apartment. You live by yourself, but you have the choice to ask people, staff from the community, to come in and help you with things like maybe you need a little help with housekeeping. Maybe you need someone to stand in the apartment while you're taking a shower because you're a fall risk. Maybe you need someone to help you with grocery shopping, so you're going to use the transportation services. But you are completely free to come and go as you please, and you're alone a lot of the time, and you make all your own choices about how you live your day. In memory care assisted living, this is typically where people who are living with Alzheimer's disease, FTD, or related dementias in the moderate and late stage would benefit from a secure environment with a highly structured program and staff support 24/7. So let's talk a little bit about what that looks like. So most memory care assisted livings do have nurses on staff. And their primary function in the assisted living memory care environment is to administer medications. Secondly, their very important role is to assess residents to understand, ooh, does this person have an infection? If they had a fall, assessing them, do they need to go out to a hospital for further evaluation? If they look like they have a cold or an infection, do they need to have a doctor's appointment to have antibiotics or other medication prescribed? Typically, in a memory care assisted living environment, a nurse will be present during the day. They'll be present maybe from 7 a.m. to 7 p.m., 8 a.m. to 8 p.m. They're present during the daytime. At night, they're on call. So what does that mean? That means that if the overnight staff that's monitoring the residents in the memory care assisted living, they're doing their nightly checks on people in their rooms. If they notice that someone has fallen out of bed, they're going to call the on-call nurse and walk through, some questions to decide whether or not this person needs to go to the hospital for further evaluation. But it's important to remember that often in memory care assisted living environments, a nurse is not physically present all the time. You're going to have activity staff. You'll often have certified nursing assistants that can assist with personal care. There will be a robust schedule, music, animal therapy, holiday celebrations, Tai Chi, yoga, all catered to be appropriate to the cognitive functioning of the residents. It's meant to help people feel connected and part of a community. They typically have their own apartments, so they could have their own room, which is typically a bedroom, maybe a small kitchenette area, and a private bathroom. And then some of those apartments, you could have a roommate. They are secure environments, so if people were to try to leave, an alarm would go off. For many families, this provides comfort knowing that their loved ones are secure and safe. And there is staff there 24/7, but usually fewer staff in the late overnight hours. Respite care is something, most people don't know that you can approach your local memory care assisted living and ask about respite options. So let's say you are caring for someone at home and you realize, oh my goodness, I have to go to the hospital. I have to get my knee replaced. So I'm going to need to have surgery. I'm going to need to have rehab. I won't be able to be fully present to care for my loved one during this time. You can approach your local memory care assisted living, and many of them often have respite options, opportunities that could be 30 or 60 days at a time. The apartments would come furnished, and it would be a way for your loved one to be in a safe environment while you did something that you needed to do that would take you away from being a caregiver. So I just always like to mention that. How do people pay for memory care assisted living? Unfortunately, private pay. There is not health insurance that covers stay in memory care assisted living. If you have long-term care insurance, that will often cover a portion of it. And while we're talking about paying, it's important to note and to really pay attention, and especially when you're talking with the admissions person at a memory care assisted living, to understand that the initial price for renting the apartment may not be the total price that you pay at the end of the month. Because as care needs increase, the cost typically increases. So if your loved one moves in the moderate stage and they don't need help in the shower, but as they progress to later stages and they do need help with personal care, then there would likely be additional charges. So it's just really something to consider. And these discussions and costs of care can be a part of robust conversations with your doctor, your attorney, your financial planner, all to help you sort of think about what might we need and how can we plan ahead. Where can you find memory care assisted living? Contact the Alzheimer's Association helpline and request a list of facilities local to your zip code. Okay, so skilled nursing care. So oftentimes when I'm working with families, there's sort of this question around like, what is the difference between memory care assisted living and skilled nursing care? And I think that this is very fair, right? If you've never cared for someone in later stages, if you've never needed skilled nursing care yourself, it makes sense that you wouldn't understand the nuances. So, like assisted living memory care, it provides that 24/7 residential care. But the difference is to be a part of a skilled nursing community, to be a patient, a resident there, you have to have a medical need. So there's really two types of skilled nursing care. The first is like short-term rehab. So this might happen after you've had a surgery. Maybe you're not ready to go home. You need that medical care. You're going to be transferred to a skilled nursing facility for a short period of time, usually a maximum of 120 days. And Medicare or your private health insurance, if you're not on Medicare yet, would pay for you to stay in this skilled rehabilitation environment where you're going to get medical care and you'll likely get rehab services like occupational therapy, physical therapy, maybe even speech therapy to help you with swallowing. But what if you have a chronic health condition like ALS or dementia, right? Alzheimer's or FTD in the late stage, where you really need 24/7 support to live your life, to engage in any activities of daily living. That's going to be skilled nursing long-term care. And the real difference here, the difference between memory care assisted living and a skilled nursing environment is that you're going to have medical staff present at a skilled nursing facility all hours of the day. It's an environment where they expect that people have medical needs and that they expect that people need help with all activities of daily living, like eating, dressing, bathing. Um, and how do you get connected with one of these programs? Typically, you need to have an evaluation by a medical provider who says that you're medically appropriate and would benefit from care in this environment. I think that working with families, this is probably the area of care where they worry about the most, like, how will I afford it? And so it's critically important that you work with your elder law attorney. You can also connect with your state health insurance assistance program. Sometimes these are called SHINE representatives to talk about applying for Medicaid long-term care coverage. So I think it's important that I point this out. So if you are in skilled nursing for a short period of time, that rehab, right, the max 120 days, that is paid for by Medicare and private insurance. But what if you need that long-term care? You have a chronic condition. Long-term skilled nursing care is paid privately, out of pocket, or it's paid by Medicaid. It can also be paid for through long-term care insurance. I think that for most families, especially those I've worked with over the past decade in the MGH FTD unit, they are considering, applying for Medicaid to help cover this expensive cost of care. That can be a short period of time or go on for years. So talk with your attorney, talk with your financial planner. If your doctor thinks that you or your loved one will end up needing skilled nursing care, you want to know if you're eligible to apply for Medicaid to help you pay for it. I think another type of care that we want to talk about as a supplement is palliative care and hospice services. Medical eligibility is required for hospice admission. Just like a doctor would need to say you're medically eligible for skilled nursing care, they'd also need to say it for hospice or palliative care. This is often after a medically qualifying event. So maybe you've had just a change in your functioning, maybe you had a fall, maybe you've had disease progression, or you have an assessment from your medical provider, such as your primary care physician at like a routine or a follow-up appointment. So palliative care is something that you can get very early on. Palliative care is something paid for by Medicare, and it's for people who are living with chronic, life-threatening conditions, complex medical conditions. Palliative care is often provided through your local hospice provider. So you could call your local hospice provider and say, do you provide palliative care services? I'd like to have my loved one evaluated. And then they'll let you know what referrals they need from your physician or medical provider. What does palliative care do? It's not hospice. Palliative care is more thinking about it's a way to think about approaching care, especially care for complex medical conditions. It gives you access to a nurse who you can talk with about making decisions for healthcare. I remember that many of our patients have benefited from palliative care as a way to help screen them. Ooh, I'm not feeling so great today, or something has changed. Should I go to the hospital to receive an additional evaluation? So they would reach out first to their palliative care provider to get that evaluation, sometimes in their home. And it's a way to make things a little bit easier along the journey. And especially as you get in the moderate or late stages, it can be very stressful to go in for extra appointments, to go to the hospital. So any care you can receive at home can be beneficial. And then talking with families about hospice. I can see people sometimes become incredibly stressed thinking, oh my gosh, hospice. I didn't know that we were at the end of our journey. I've had the privilege of working with people. In fact, one patient that was on hospice for 2 years. Many of our patients have been on hospice for over a year. And hospice provides a wonderful array of services that many people don't know about, including equipment, including medication provision and management, regular evaluations from a nurse who comes to your home or to your skilled nursing environment or your memory care assisted living, depending on wherever you live. For the most part, hospice can go to where you're living. They provide you with 24/7 access to care, meaning you have a direct line to a healthcare provider who can talk with you every step of the way when there are changes, when you need to make a new decision, when you need support. And did you know that hospice provides services, support services, grief services to family members and caregivers of loved ones who've died for 13 months after their passing? So it really is a wonderful opportunity to think about, gee, we're at home providing care, but we need more support. Or we're in a skilled nursing facility, but now we're in the late stage and things are happening. Maybe we're having more infections or like skin breakdown. Hospice can come in and provide those additional, unique expert supports that can help you achieve comfort, goals of care, and live your values, whether you're caring for your loved one at home or in a facility. Who pays for hospice? Typically, you could pay privately, your private health insurance, but Medicare will often pay. And if you're in a PACE program, which I'll talk about next, you do need a referral from a physician, but even if you reach out to the hospice program directly, they'll often tell you, okay, this is how we need the referral, and they walk you through things. They tend to, I think, be really supportive and make things easy. I wanted to just put up this additional slide thinking about hospice. I often find it's not that people don't want the extra equipment or the volunteers or the visiting nurse. It's that they're worried. Well, if we start hospice, it means we're giving up. But if you can view palliation and hospice care as a gift instead of giving up, it can open the door to services and support during a critical time. I recently was able to attend the Harvard Dementia course and listening to so many incredible neurologists and care providers speak about the value of hospice and palliative care, noting that, none of us are getting out of this alive. And we want to be thoughtful about how we want care to be at the end of life. One speaker talked about how when we embrace death, it makes us free to live. And so knowing that the care that you have in the early stages, the care in the moderate, the care at the late, it's all critically important. It's all a part of living with the diagnosis. And it can be a way that you feel like you've done everything you can to care for someone who's living with a disease that is relentless in its pursuit to take our loved ones from us. Additional support can be through the PACE program. Uh, PACE programs are programs in your local community where you have to meet a couple of criteria. You must be 55 years of age or older. You have to live within the PACE service area. It has to be determined that you would be eligible for nursing home level care. And you have to meet income eligibility. But For people who are eligible for PACE, it is an incredible wraparound program that can provide things like home care, transportation, adult day health, skilled nursing care, hospice. So I would encourage you to find out if you're eligible for PACE. And you can do this by contacting your local Council on Aging or your area agency on aging. So, pop into your local senior center, your local council on aging, and ask, say, does anyone know who our local PACE provider is? And they can point you in the right direction. And of course, you can always use Google as well. This is just an extension of where do you find resources in your community? Don't forget that the Alzheimer's Association has a 24/7 helpline connected to a robust resource catalog. We want families to know that there is care and support and access to real resources 24 hours a day, 7 days a week, 365 days a year. Caregiving and dementia don't take a day off, and neither do the staff at the Alzheimer's Association helpline. So reach out and call them. Recently, I called the helpline to find out about local adult day health programs. From the time I dialed the number to when I received a PDF with a list of local adult day health programs for my patient and caregiver, the amount of time was 8 minutes. So they really are, wonderful, and you get to speak with someone who's expertly trained about not only Alzheimer's, but all types of dementia. Planning ahead. So, when you want to plan ahead for care in the moderate and late stages of dementia, you're probably planning ahead, thinking about what if we need residential care. So, that's the memory care assisted living, that's the skilled nursing care, and it can even be thinking about will we need hospice? So, I think it's a great thing to identify local places. You can do this by calling the Alzheimer's Association helpline and asking for a list local to your area. Request referrals from your local providers. Ask your primary care physician, do you have memory care assisted living or a skilled nursing facility that you like? Word of mouth about recent experiences. Ask people at the local YMCA, at your senior center, at your library, your friends and family. Have they had a loved one who lived in a facility, and how did they feel about it? Visit communities and join wait lists. I think also too, when you're visiting, many places will tell you we don't have any beds available now. But you could be visiting at a time where you don't even need that service yet. But they may offer you an option to get on a wait list. Sometimes that's free, sometimes it's nominal, might be just, less than $100. For others, it could be a higher cost to just join the wait list. So really weigh these costs when you're thinking about your own financial situation and what works best for you. Most importantly, talk with your family and friends. I worked for years with this incredible husband caregiver to his wife, and he researched the local memory care, assisted living, and skilled nursing facilities in his area. He visited them, he put his wife's name down on wait lists, and he went to his adult children. And he said, if anything happens to me, I've chosen these facilities, and your mother's on the wait list for them, so that if something happens to me and I can't care for her, you will know that there's already a plan in place. And when he told me that he did that, I thought it was such a gift and also a real way of expressing his values and goals of care that was so direct. And so if, the ability for him to care for his wife changed, his adult children would know exactly what to do. Something that we talk about in our caregiver support group, we talk about with all of our clinic patients in the MGH FTD unit, and we talk about with our research participants, is the opportunity to participate in brain donation. If you're living with a condition that has impacted your cognition, mood, or behavior, you might want the opportunity to learn more about it and to find out if this information is medically relevant to other members of your family. Being a brain donor can help clinicians improve diagnostic and care skills because they're going to learn more about the conditions that impacted their patients in life through this gift after passing. You will help train the next generation of neuropathologists and contribute to a growing body of clinicians dedicated to the fight against dementia. Brain donation helps you contribute to the global scientific efforts to better understand, effectively treat, and one day have a cure for Alzheimer's and related dementia. So if you're in Massachusetts and you're interested in brain donation, you can go to ftdboston.org. You can go to the Massachusetts Alzheimer's Disease Research Center, madrick.org. But people ask, like, how does this work? Or is there a cost? There's no cost for the autopsy that's performed for a brain donation because it's for research, and we appreciate the incredible gift that that is from families. There is typically a cost for transportation that is provided by your funeral home to drive your loved one from the place that they've passed away to the hospital to make their gift and then back. If you are a patient or a research participant in our program at Mass General, this cost may often be covered. There are programs all over the country and, in fact, around the world for brain donation for individuals living with Alzheimer's, FTD, and related dementias, but also for individuals who are just normal agers. So learn more, ask your physician, reach out to your local Alzheimer's Disease Research Center, and consider if brain donation is right for you. Love is on the list. Love is on the list of care planning, of things to do, of considerations to make. And it's just to really remind you that love is available to you at every stage of your journey with dementia. That's not only love from the person living with the diagnosis, love from the care partner, but love from this community of people impacted by dementia. So, if you haven't connected yet with your local area agency on aging, with your support group at your local hospital, if you haven't yet found your patient advocacy organization, which will be the topic of our next webinar, consider how love and support can be a part of your person-centered care plan. Key takeaways from today are that it is important at every stage or with every change, major change, to review your goals of care, your financial planning with legal and financial experts. Please remember, making a plan B, thinking about care for the caregiver is critically important at every stage of care planning. And plan ahead. You know, when we talked about what do you do right after diagnosis, we said it's never too early to talk with family and friends about your values and your wishes, your plans during every stage, but especially the late stage of care. Well, it's also never too late. At any time you can bring up these topics with people who you trust, your medical provider, your mental health provider, your faith leaders. Have discussions so that you have time to talk about these very important and personal topics before the moment is upon you. I would like to thank everyone today. Thank you for your time and attention. Thank you to everyone in our community, persons living with a diagnosis, care partners, and all families that have been impacted by dementia. You help us know that we can bring the cure of tomorrow closer to the care of today. We wouldn't be a program without all of you. Thank you so much. Now, I'm going to invite my wonderful colleague, Amy Almeida, to join me so that we can have a discussion and answer some questions related to this second module for the home community. Amy, I'm going to stop sharing my screen. Perfect. So nice to see you today.
So good to be here, Katie. Oh, let me put us closer together. Thank you for such a really in-depth discussion and description of, the significant differences between memory care assisted living and skilled nursing care. Why do you think families are so confused about this topic?
Yeah, I think it's really because of the model and the way that memory care or really assisted living can be presented to families. And there's such a wide variation in the type of care. There's many different companies that provide assisted living memory care, and we have had patients. I've had family members that have lived in assisted living memory care and had wonderful experiences being part of the memory care community. But I think that also sometimes admissions people or administration at those programs promise families that they can provide all of these services that while on paper they can, really, as people advance to the late stage of care, it's just more appropriate that they're in a fully supportive skilled nursing environment.
Yeah, and while we're on the subject of promising, we've heard from families, many families in our support group, that either they have made the promise to their loved one to never put them in a facility, or their loved one has asked and requested and sometimes begged, please don't ever put me in a facility like that. How should families think about considering residential care if, such promises or requests have been made?
Yeah. I love how you're using the word promise because that's really what it is. We meet with people and caregivers say to me, "Well, I promised my mom that I would never." And you know what's so hard about that promise is that you're often asked to make it at a time where you don't even know what's coming ahead. You don't know what you're promising. And when I work with families and they say things like, "Well, we never want to use a skilled nursing facility because that's not what my loved one would want." When I really dig down and ask families about their values, their worries, I'll say, what's the biggest thing that's keeping you up at night? What most people with a diagnosis express to me is that they don't want to be abandoned. They don't want to be alone. And what most care partners express to me is that their loved one wouldn't receive the highest quality of care. And so it's then my job to talk with families about how working with 24/7 residential care settings like memory care assisted living or skilled nursing care can in fact be a partnership for families. You know, you can't be a wonderful caregiver providing the highest quality of care if you are a petite person with maybe some physical limitations and your loved one's twice your size and now is having motor issues related to their condition and they can't stand or walk safely. How are you toileting them? How are you getting them in the shower? If people have swallowing issues, they might benefit from being in a more supervised environment. I tell families, in a facility, they have different staff for laundry, medication, meal prep, cleaning, activities. And those staff work in shifts and rotate. But when you're at home, you're expected to be everything and you never get a break. We have some wonderful people in our support group, and I think something that I've mentioned many times, especially to couples or just family members, is when you bring more people onto your care team, it allows you to relinquish some of those caregiver duties so that you can then be the part of the caregiving that only you can do. You can be the daughter, the wife, the husband, the friend. So, I think it's just helping families think about, well, what's the promise you can make? Maybe the promise is, I'll never abandon you. I'll always love you. I'll advocate for you at every stage.
And I think you pointing out that advocacy piece, I know that we had my mom in a skilled nursing facility. We moved her there after she had lived with FTD probably about 4 years. And I thought, oh, now that she's in a skilled nursing facility and I'm not doing the hands-on care, it's going to be so much easier. But it wasn't, I don't say it was easier. It was different
It was
because I
different.
had to exercise different caregiving muscles when she was in the skilled nursing facility than I did when she was at home.
Yeah.
When do you think families should, consider thinking about moving their loved one to memory care assisted living or a skilled nursing facility?
I think early on they should consider what if this is a possibility? Because I think that people want to imagine that whatever their situation currently is, that'll be the same situation 5 or 10 years down the road. But we know that things happen, right? So, the health of the care partner might change. And so to talk with your medical provider, given my or my loved one's diagnosis, what's the likelihood that we would need this level of care? Could we anticipate how quickly we might need it? And then to talk with your lawyer, your financial planner, and to say, if we did need this care in the next 5 years, what financial changes could we make now? What financial plan could we make that would allow us to engage those services or not engage those services? The challenge is that it's the unknown that makes it so difficult to plan. I mean, you could choose a skilled nursing facility that you love, and then 5 years later, that nursing facility could close, and then you have to choose someone else. So I think what is important is to plan ahead, but then to turn back to living in the moment because we can't be sure what's coming ahead, but we can be sure about what's right in front of us.
That's great. You talked about hospice and how many families are reluctant to think about it. Why do you think families are resistant to hospice, especially when, you and I have seen so many families that have had really wonderful success with hospice services?
Yeah, I think what has really warmed my heart thinking about people engaging with hospice services is that they've expressed to me that it has helped them to live their values, to focus on personhood, and really to live their goals of care. Um, Most people by the late stage, they care a lot about comfort. They care a lot about staying as close as possible to family. They care a lot about additional help and support. But I think that the old thought of hospice is that it's only for the dying. And what I have seen is that, in fact, it helps people live their lives at a very vulnerable stage with incredible dignity, comfort, and support. And so I think it's really just helping people to think of hospice in a way that allows them to be open to getting more care and comfort.
Thank you. We're going to be taking the summer off from our Care Plan Trifecta. Our next, the fourth and final webinar will be on Tuesday, September 16th. So we hope you have a wonderful summer and you can, turn to these three videos whenever you feel like you need it and stay tuned till September to get the final edition.
Thanks, Amy. You're an incredible producer of this series. And I can't help but give a plug for also our podcast from Care to Cure, where we talk about the Care Plan Trifecta and care planning with Dr. Brad Dickerson. And just, we hope that everyone who's connecting with us through these educational resources knows that there's a community out there to give them care and support. Thanks.
Thank you.